So having now talked about the treatment formulation and the goals, let's talk about the actual intervention. These are all lovely ideas, but bringing this into the room can be very difficult. And it can just, in a general way, be hard to help our clients who are struggling with depression to shift their perspective enough to actually go and make change in their lives. One of the most important interventions that I think is available to us in ACT is our use of language. And I think that a lot of what this looks like is available in other traditions as well. This is not just ACT necessarily. But we do often think of our interactions in session as being opportunities to try to create desirable behavior, in addition to hopefully having a meaningful interpersonal conversation. So in session, I'm always thinking in terms of how am I using language to shape up better behavior, and how am I using experiential work? So let me speak briefly to use of language in session. Thinking in terms of the core processes that we're trying to shape up, one of the things that we can be doing in session is to encourage the client to be in the present moment. Hannah was stuck in the past and scared of the future. And so a lot of the work just in the conversation was, what's happening for you right now in this moment? As you remember that horrible thing that happened to you, how are you feeling right now in this moment? Is it better than it was? Is it worse than it was? Right? Or can we take a moment to just drop anchor and be here for this work instead of back 6 months ago? What do we want to make important in this moment? So just the language is saying, try to be here. There's also a lot of language in ACT that we can use and in other traditions to just notice, wow, your mind tells you some really harsh stories about yourself. That whole I'm broken story, that's rough. That's painful. How long have you had that story? How long has your mind been telling you that story or that thought? So we're using the conversation to invite clients to notice that what's happening thinking-wise is part of a broader experience, not necessarily some hard and fast truth about yourself or the world. We're also inviting clients using language in session to catch emotions, notice them, stay with them, slow down with them. Sometimes people think of acceptance as an end state, and it's not an end state. It's a process of showing up for what's happening, even if it's painful and hard, and being with it so that you can get good at having hard stuff, hard feelings, hard thought, and still live your life. So we invite clients in session to say, what's happening right now? A lot of the mindfulness practices, which plenty of therapists are using, lend themselves beautifully to this, to slow down, pay attention, be present. Additional pieces that I think are really valuable is using the therapeutic conversation to reflect back values when clients don't have a lot of clarity on their values or need support in their values. Almost any conversation provides an opportunity to say, wow, you really care about being a spiritual person. Or for Hannah, you really care about being a good friend. You really care about being reliable. You really care about learning how to be the best writer you can be. You helping them shape up more helpful stories that are tied to values. We also want to reinforce small moves in the desired direction. So when I would say, did you do that 1 minute a day meditation that we agreed on? And she says, no, not really. I did it a couple of times. That's an opportunity to say, wow, you did it a couple of times. How did it go? As opposed to, oh, you said 5 and you only did it 2 times. How was it? What'd you like about it? What'd you not like about it? What can we do differently next time so that you could do more of it? We want to reinforce even tiny, tiny, tiny moves towards what we want, because as clients deep in depression have trouble making any kind of behavior change.